Calling the Health and Human Services deferred calendar from Monday. We are continuing on with SB 710. First up, we have SB 710 relating to child welfare. We have, excuse me. Okay, well, let me read my script. For those on Zoom, your audio will be muted and video disabled until it's your turn to testify. If excuse me, I thought I was ready. No, this is a regular calendar. This December 10th. We were up to 483 rate study.
483, Senator.
483 was where we ended up. Okay, relating to rate study for home health services.
And the agenda begins with 710 today, Senator.
Okay, I don't have, 710, excuse me. We ended with 480. Relating to child welfare. First up, Director Yamane, providing comments.
I'm here on behalf of the Director, Stacey Hartsfield, the Social Services Division Administrator. Just appointed submit written testimony, which is my original training questions. Thank you.
Thank you very much. Next, we have Deputy Attorney General on Zoom, providing, nope, in person, providing comments.
Yes, my name is Lynn Yeomans. I'm a Deputy Attorney General, and thank you for the opportunity to provide written comments.
Okay, thank you very much. Next, we have Tia Hartsock, Office of Wellness and Resilience, Office of the Governor in support. And I apologize. Those of you who have been to my hearings before know we do have a 1-minute time limit. And for those who realize what occurred on Monday, bills are going to die unless we are able to pass it out today. So I am going to be very strict with the 1-minute time limit. And I apologize for those on Zoom or those who came all the way from wherever for their for testimony. Okay, Tia Hartsock, first up in support.
Aloha,
Please proceed.
Tia Hartsock, Director of Office of Wellness and Resilience in Governor's Office. Thank you for the opportunity. Just standing on our testimony, we would also want to note the Attorney General's testimony and defer to them for a mechanism on moving this forward. We are very open to the conversation, but recognize the separation of power per the AG's testimony. So I just wanted to state that, but very, very much in support of the content and the intent of this bill. Thank you for that.
Thank you very much. Next, we have Malama Ohana Working Group, Laurie Tochiki, and support.
Thank you, Senator, and we really appreciate your support and for this and for all the bills. I do want to state, though, that we really urge you to pass this one and the next one. And we know that it's very scary. We're all really very frightened about what's going to happen to the safety net. But this situation is dire. When we first did Malama Ohana, people said we were naive, that the government wouldn't listen, the DHS wouldn't listen. And now I'm holding all of these stories of fear and anger, and I sometimes feel like we're being gaslit, like, oh, no, it's not so bad. It is important, and we need leadership, we need innovation, and we need commitment, and we need it now. Thank you.
Thank you very much. Okay, Noreen Cole, Hawaii Children's Action Network in support, Hawaii Youth Services Network in support, Opportunity for Youth Action Hawaii in support, Hawaii Coalition for Child Protective Reform in support, Karen Worthington in support, Glenn Oshiro in support. Anybody else wishing to testify in SB 710? Members, any questions? Well, it's only me, so we're moving on. SB 712. First up, regarding,
952, Senator.
No.
Based on agenda.
$9.52, relating to child welfare services. Yes, first up, we have, okay, it's not in order on mine, sorry. First up, we have Ryan Yamane, Director of Human Services, providing comments.
Again, good afternoon, Chair Daisy Hartsfield, Social Services Division Administrator. On behalf of Director Yamane, the department did submit written testimony, which it stands by. We do defer to the Office of Wellness and Resilience and the Department of Health, and I'm available for any questions. Mahalo.
Okay, thank you very much. Next, we have Tia Hartsock, Office of Wellness and Resilience, Office of Governor in support.
Yeah, just stand on our testimony and support, and I'm here for any questions. Thank you.
Okay, thank you very much. Next, we have Laura Tochiki, Malama Ohana Working Group in support.
Stand on your testimony. Thank you.
Thank you very much. Next, we have Opportunity for Youth Action Hawai'i in support. Hawaii Children's Action Network speaks in support. Judith Clark, are you present on Zoom?
Yes, I am,
Okay.
Senator. We are in full support of this bill. I'm not sure why I can't get video, but
There you are.
okay, there I am. Anyway, we fully support, we're on 952. I am a member of the Trauma Informed Care Task Force, and over the past 3 years, we have worked to develop a statewide plan for making Hawaii a trauma-informed state. This bill incorporates many of the recommendations from the task force. It will help families to access services and provide material support for basic needs. It will help to reduce the overload on the child welfare system. Thank you.
Okay, thank you very much. Next, we have Karen Worthington in support, Dara Carlin in support. Anybody else wishing to testify on SB 952? Okay, next up, we have SB 954 relating to rate study for home health services. Brian Yamane, Director of Human Services, providing comments.
Aloha, Chair.
Oh, okay, Judy Moore Peterson, please.
Yes, aloha. We stand on our written testimony offering comments, and I'm available for any questions. Thank you.
Okay, thank you very much. Next, we have Hilton Raithel or Paige Choi Healthcare Association of Hawaii on Zoom in support. Are you present, Hilton or Paige?
Aloha, Chair. This is Robert Choi, Senior Director of Post-Acute Care here at the Healthcare Association. On behalf of Paige Choi, who had a conflict for this agenda, HH stands on its testimony and support, and I'm available for any questions.
Okay, thank you very much. Next, we have, oh, anybody else wishing to testify on SB 954? Seeing, okay, please put, no, I'm on 950, you're right. No, we're 954, we're way past 952.
Apologize.
954. Okay, proceed. I'm sorry, you got to start over again because we got interrupted. You have 1 minute.
Aloha, Angela Melody Young testifying in strong support on behalf of CARES. I think a rate study would be very beneficial, and with, of course, the appropriation of funds for the home health services, because when the funding from the federal office is distributed to the state, it is intended to help low-income families and middle-class families to get more home health care services. And sometimes, there are gatekeepers that kind of just hold on to the money and they don't want to give the money. And so we want to be, I think, well, from my perspective, as generous as possible to people such as those who are suffering from disabilities and also kapunas, seniors, to get just very basic personal assistant level 1, level 2 services, because that's what the intention of the federal funding is for, to help those with the worst health. Thank you.
Okay, thank you very much. Next, we have, anybody else wishing to testify on SB 954? SB 957, moving on. Or any questions on 954? Okay, we're gonna move on. 957, relating to overdose prevention. First up, we have Department of Health in support.
Good afternoon, Chair, Vice Chair. I'm Tim McCormick with the Communicable Disease and Public Health Nursing Division of the Department of Health. Department stands on its written testimony and support, but I just wanted to add a couple comments. Overdose prevention centers are an evidence-based intervention that can be remarkably effective preventing overdose deaths among people who use illegal drugs. These facilities aim to prevent deaths, injuries, and infections among people who use illegal drugs and are not yet ready or able to quit using drugs. They also offer increased access to and engagement in substance use disorder treatment, reduce public drug use, reduce overdose-related demands on first responders and the healthcare system, and as a result can be cost savings. The department also recognizes that this type of intervention, it's critical that it be implemented in a way that does not undermine law enforcement efforts to combat illegal drugs and other criminal activity. I'm available for any comments. And thank you, Senator, for introducing this bill.
Okay, thank you very much. Next, we have Blair Gatto, Attorney General, providing comments.
Good afternoon, Chair Buenaventura, members of the committee. My name is Blair Gatto, Deputy Attorney General. As the Department of Health indicated, Senate Bill 957 would allow overdose prevention centers to provide harm reduction services to illicit drug users. We wish to point out, however, that federal law prohibits opening a property to others to use drugs. The penalties for violating Section 856 of 21 United States Code include civil penalties of up to $250,000, criminal penalties of up to 25 years imprisonment and a fine of $500,000, or both, or for a person other than an individual, a fine of $2 million. Because of the severity of these penalties, finding someone to operate overdose prevention center would seem unlikely. If the committee wishes to advance the bill, our written testimony contains our recommended amendments, and I am available for questions.
Okay, thank you very much. Okay, next we have Aaron Rudick, Free Hawai'i in support, Hawaii Public Health Association, Holly Kessler in support, Hawaii Health and Harm Reduction Center, Nicholas Leverins in support.
Aloha, Madam Chair, Vice Chair, members, Nicholas Leverins with the Hawaii Health and Harm Reduction Center. In very strong support, mahalo to you, to the Department of Health, and to Mr. McCormick himself for your leadership in implement or addressing this bill. As Mr. McCormick said, these facilities are associated with reduced public drug use, lower demand in local healthcare and emergency response services, and no increase in crime. We have a 2-decade record of success in other countries, and 4 years in operation in New York City, not one single overdose death. Mahalo.
Okay, thank you very much. Next, we have Rick Ramirez in support, Teki Walker in support, Jason Harris in support, Cindy Nawilas in support, Thaddeus Pham in support, Dara Yatsushiro providing comments, Carla Allison in support. Anybody else wishing to testify on SB 957? Okay, members, any questions? Okay, moving on, SB 1609 relating to childcare. First up, we have Director Yamane in support.
Good afternoon, Chair Stacy Colucci, Child Care Subsidy Program Director,
Yes, thank you. Thank you. Yuko Arikawa Cross, Executive Office on Early Learning, providing comments.
Yes, we stand on our written testimony of comments.
Thank you very much. Jordana Ferreira, City and County of Honolulu, in support. Okay. Vivian Ito, Early Childhood Action Strategies, in support. Are you present?
Yes, aloha, Chair, Vice Chair, we stand on our written testimony in support and are available for questions.
Thank you very much. Jean Evans, AAUW, in support. Angelina Mercado, Hawaii State Coalition Against Domestic Violence, in support. Ryan Kusumoto, in support. Chevelle Davis, Hawaii Children's Action Network, speaks in support. Chevelle?
Yes, and Chevelle Davis with Hawaii Children's Action Network, and we stand on our written testimony in support.
Thank you. Okay, Deanna Espinas in support. Caitlin Chris in support. Terry Locke in support. Jesse Gonzalez in support. Leanne Jernigan in support. Shay Chan Hodges in support. Christopher Castillo in support. And 4 other individuals all in support. Anybody else wishing to testify on SB 1609? Members, any questions? Seeing none. I'd like to announce that I understand that originally we had scheduled SB 950 for the Monday calendar relating to trauma-informed care. That isn't in today's calendar because we are going to be deferring that in lieu of SB 1398, which has already passed. Also on the calendar originally was SB 954 relating to, oh, we did rate study. And, hold on. Right now, I think, so any and all bills that were in the original Monday calendar that is not on this calendar is being deferred because the House version is moving or there was already a Senate bill that has passed. So we're not going to be duplicating those. Okay, anybody is here because of that deferred Monday calendar. In the meantime, we're going to do a short recess for decision making. Okay, let's go find quorum. Short recess to get quorum for decision making. Calling the 1 o'clock calendar, regular calendar for today. First up, SB 850 relating to disability health disparity. Oh, we do have find somebody. Let's go read this one before we do the decision making on the other one. First up, we have Carolyn Carrera, Executive Office on Aging and Support. Kirby Shaw, DCAB and Support. Kirby Shaw, are you present? On Zoom.
Not present on Zoom, Chair.
Dainty Bartolodis, Hawaii State Council on Developmental Disabilities and Support.
We'll stand on testimony and support. Thank you, Chair.
Okay, thank you, Dainty. Tia Hartsock in support. Thank you very much. Louis Urchik, Hawaii Disability Rights Center in support. James Kilgore in support. Hawaii Self-Advocacy Advisory Council in support. Leilani Kaileava in support. Ellen Avai in support, Daniela Bondsmith in support. Anybody else testifying SB 850? Okay, you got 1 minute.
Angela Melody Young, cares and strong supports. So studying disability disparities can help with, for example, workforce development training to build out programs such as the Blind Services Branch for Blind Vendors training for business owners who are disabled in Liliha. And it's just an example of something that could be a very effective result of a disability disparity study, and the training can help all others who also have disabilities and get to a common goal of supporting marginalized communities, as well as helping the families sustain business operations. So then it saves on government funding in other ways. And also, I worked with a disability advocate, and it's very efficient to work with those who are disabled. So, you know, they should be more employed in efforts. Thank you.
Thank you very much, Angela. Okay, any members, anybody else on SB 850? Okay, seeing none members, any questions? Okay, we are going to recess that calendar and go back to decision making for originally the Monday, February 10th calendar, and that was deferred to today. So first up, SB 298 relating to human services. Chair's recommendation is to pass with Department of Human Services amendments and a defect date of December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. 298.
Okay, members, recommendation is to pass with amendments, Senate Bill 298. Chair and Vice Chair vote aye. Senator Hashimoto. Aye. Senator Keapolole. Aye. Senator Favela. Aye. Recommendation is adopted, Chair.
So for SB 322, Chair's recommendation is also to pass with amendments and technical, with DHS's amendments and text amendments needed for clarity and consistency. And the effective date. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote. Pass with amendments. SB 322. Yeah, SB 29, excuse me. Oh, no, we're not deferring that one, but I forgot. We're gonna go to
322.
322, and then we're gonna go back to 299. Thank you.
Thank you, Chair. Okay, Senate Bill 322, recommendation of the chair is to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, and my Vice Chair, remind me, I forgot SB 299. Chair's recommendation on that is to pass with blank appropriation and a defective date. We're gonna note that in the committee report, $30 million appropriated in 2024 helped over 800 medical professionals stay in Hawaii. So we hope that WAM considers that. Pass with amendments. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Okay, Senate Bill 299, recommendation of the chair is to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Thank you. And as previously announced, SB 323, SB 324 have been deferred indefinitely. Next would be SB 450, relating to autism. Chair's recommendation is to pass with amendments. We're gonna remove the preamble and accept Department of Human Services proposed amendment, and we're gonna put in a defective date of December 31, 2050. Keep the conversation continuing. Any comments, questions, or concerns? Pass with amendments.
Okay, Senate Bill 450, recommendation of the chair is to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
For SB 451, Chair's recommendation is to just pass that with a defective date. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote, and hopefully we will have, by the time of conference, have DHS give us the amounts needed for full Medicaid buy-in. Pass with amendment, sorry.
Okay, Senate Bill 451, recommendation of the chair is to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 479, Chair's recommendation on that is to pass with amendments. We're gonna remove the term Hawaii Public School from page 1, lines 9 and 12 to 13, page 3, line 8, and page 4, lines 8 to 9. We're also gonna add a defective date of December 31, 2050 to keep the conversation going. Any comments, questions, or concerns? Hawaii Able Program. Chair, Vice Chair for the vote.
Okay, Senate Bill 479, recommendation of the chair is to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
As previously announced, we are deferring SB 480, SB 481, SB 482, and SB 483 because the House companion is moving. Okay, or something has previously passed that's similar. Next, for SB 710, we are gonna pass this with Attorney General's concerns and remove the legislators from the task force because of the separation of powers, and have it chaired by the Office of Wellness and Resiliency, and blank out any appropriation, tech amendments needed for clarity and consistency, and add a defective date of December 31, 2050. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote, pass with amendments.
Okay, voting on Senate Bill 710, recommendation of the chair is to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, as previously announced, SB 712, SB 950, SB 954, SB 956 are going to be deferred because the House is moving, and that includes the home health services that we had received testimony on. Next up is SB 957, relating to overdose prevention. Chair's recommendation is to pass this with Attorney General's amendments to Section 5A, their corrections, tech amendments for clarity and consistency, and a defective date of December 31, 2050. Any comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Yes, Senate Bill 957, recommendation of the chair is to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 959, we are going to defer that because the House companion is moving. And for SB 1609, relating to childcare, Chair's recommendation is to pass this with amendments. We're going to accept Department of Health's proposed amendments, tech amendments needed for clarity and consistency, and a defective date of December 31, 2050. Continued conversation.
Senator, SB 952.
Let me finish voting on SB 1609 first, and then we'll do 952. SB 1609, Chair's recommendation is to pass with amendments.
Yes, Senate Bill 1609, recommendation of the chair is to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, I've been told I forgot SB 952. Chair's recommendation is to pass this with amendments. We're going to amend the 2 years and make it a 5-year pilot program. Blank out the appropriation, put in a defective date of December 31, 2050. Any comments, questions, or concerns? To pass with amendments, Vice Chair for the vote on SB 952.
Okay, recommendation of the chair is to pass with amendments, Senate Bill 952. Okay, all members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Thank you. Okay, any other bills I forgot? 954. Oh, I believe I announced that one, we are going to defer that one because the House companion is moving. Okay, any other bills I may have forgotten from the Monday calendar? Okay, seeing none, we're gonna move on to continuing the 1 o'clock regular calendar. Next up, SB 838, relating to health insurance. First up, Director Yamane, providing comments. Judy Moore Peterson, please proceed.
Aloha, Chair, members of the committee. We stand on our written testimony. We defer to the Department of Health. We appreciate the intent, offer comments, and are requesting some amendments. Thank you.
Okay, thank you very much. And I'm sorry to cut you off. I thought you were going to just stand. Okay, next is DCCA Insurance Division providing comments.
Good afternoon, Senator. Madam Chair, Vice Chair, Secretary Chair.
Okay, thank you very much. Next, we have Deputy Attorney General Kim providing comments.
Good afternoon, Chair, members of the committee, Deputy Attorney General Andrew Kim. We provided written comments on the requirements for 23-52 report and possible deferral. Thank you.
Thank you very much. Next, Dr. Lewin, Hawaii State Health Planning and Development Agency and support.
Good afternoon, Senator Sam Buenaventura, Vice Chair Kino, and members. SHPTA is in strong support of this measure. We understand that there's a cost attached to glucose monitors, and they're not for every person with diabetes. Just wanted to kind of attribute the secretary in our office in her 50s with unstable insulin-dependent diabetes was denied a glucose monitor on 2 occasions, and she died of the complication. So this does happen. It's not, that's kind of rare, but the point is that for some people, these are important, and we want to make sure they're available for those individuals. So thank you very much for the opportunity to testify.
Thank you very much. Next, we have Hawaii Association of Health Plans, Rachel Wilkinson providing comments. Okay, thank you very much. John Kurmitsu, Kaiser Permanente providing comments. Are you on Zoom, John?
Not present on Zoom, Chair.
Okay, next we have Jessica DeCamp, Kilo Benioff Medical Center Foundation and support. Palani Smith, Liberty Dialysis, Kidney Care and support. Christine Falabelle, American Diabetes Association and support. Vice Fukunaga in support. Anybody else testifying SB 838, continuous glucose monitoring? Members, any questions? Okay, seeing none, moving on. SB 836, relating to water catchment systems. Department of Health providing comments.
Good afternoon, Chair San Buenaventura, Vice Chair Aquino, and members of the committee. My name is Michael Burke. I'm with the Department of Health. Submitted written comments. We stand on our written comments and other relevant questions. Thank you.
Thank you very much. Purple Maya Foundation in support. Margot Solari in support. Margot, are you present on Zoom?
Not present on Zoom, Chair.
Okay, thank you. Moving on. SB 829, relating to healthcare. First up, we have Jack Lewin, State Health Planning in support.
I'm available for questions if you want to have your testimony on this. It's a complicated bill, but you'll be available. Thank you, Chair.
Thank you. Next, Rachel Wilkinson, Hawaii Association of Health Plans, providing comments.
We'll stand in our written testimony after the comments.
Thank you very much. Paige Choi, Healthcare Association of Hawaii, providing comments. Okay, HMSA in support. Jan Diensman.
Good afternoon, Chair, Vice Chair, members. Appreciate the opportunity to testify in support of this measure. While it's a complicated looking bill, it's actually kind of simple in that we're trying to ensure that rotating physicians who go to neighbor islands to fill gaps or pukas in care can do so without having privileges at the local hospital on the island. It's actually an issue on Maui in particular, but it is a statewide issue as well that we'd like to address with this legislation, and it just mirrors aligning to CMS rules. Thank you.
Okay, thank you very much. Next, we have Randy Kurhara, Community First Hawaii and support, Hawaii Association of Professional Nurses and support, United Healthcare and support. Anybody else wishing to testify on SB 829? Okay, sorry. Yeah, can I finish?
Good afternoon, Lauren Kim, Policy Planning Officer for the Department of Health. The department did not submit written testimony, but we do support the intent, and we'd like this bill to keep moving. There are amendments that must go in, and we're working on them actively, and we are negotiating with stakeholders on the nature of those amendments. So at a future hearing, we'll be submitting written testimony with amendments, but we support the intent, but there's some work that needs to be done. Thank you.
Okay, thank you very much. Okay, anybody else wishing to testify on SB 829? Okay, seeing none, members, any questions? Okay, next up, relating to waste management, SB 446. First up, Department of Health providing comments. Okay, Office of Hawaiian Affairs in support, City and County of Honolulu providing comments.
Good afternoon, Chair, Vice Chair, Committee members, Michael Keith, Deputy Director of the Department of Human Services. We'll stand on our comments and we'll avail for questions.
Board of Water Supply, Ernest Lau providing comments.
Stand on our comments.
Thank you very much. Next, we have County of Maui in opposition, Sierra Club of Hawaii in support. Sierra Club, Wayne Chung Tanaka, you present?
Not present on Zoom, Chair.
Okay, Mike Ewell, Energy Justice Network, providing comments. Is that you, Mike, on Zoom?
Yes, this is me. Mahalo. Thank you, committee members. Just wanted to thank you for your decision 2 days ago to amend a very similar bill to protect the aquifer from the landfill and the incinerator ash that will be in it by amending the bill to include language that would ensure that that same ash cannot be spread all over the island, including over the aquifer in the form of roads, if that ash is allowed to be reused. So we would encourage you to place that same amendment into this bill as well to protect the aquifer adequately. Mahalo.
Okay, thank you very much. Next week, no one else having registered to testify, we have approximately 30 individuals in support. 1, 2, 3, 4 individuals in opposition, including the County of Hawaii Department of Environmental Management, and we have 3 individuals providing comments. Anybody else wishing to testify on SB 446? Come on up. You have 1 minute.
Good afternoon, Chair, Vice Chair, members of the committee. Mihoko Ito. I represent ReWorld, which is the longtime operator of H-Power. We're not opposed to this measure. We did submit very late comments. I apologize for the late testimony. But what we're opposed to is including the amendment suggested by another testifier relating to ash reuse. As a point of clarification, the City and County of Honolulu and ReWorld are working together on a project to reuse ash and reduce the amount of volume of ash going into the landfill by 60%. That process is subject to a rigorous permitting process before the Department of Health. So we just respectfully request that the committee not include any proposed amendments relating to ash, which would effectively stop the ongoing project. Thank you.
Okay, thank you very much. Next up, anybody else wishing to testify on SB 446? Okay, you have 1 minute, Angela.
Angela Melody Young testifying on behalf of CARES. The proposed location of the landfill is a hazard to public health and the environment. Trash decomposes in landfills and can cause contaminants to the water supply. It's crucial to enhance protections for water aquifers with provisions for appropriate geographic boundaries. We suggest finding a location that isn't a threat to water pollution and public health. Thank you.
Thank you very much. Anybody else on SB 446? Members, any questions? Okay, moving on. SB 339, relating to needs allowance. First up, Director of Human Services providing comments. Thank you. Ellen Owai in support. Anybody else wishing to testify on SB 339? Seeing none, members, any questions? Okay, next up, SB 556, relating to rural emergency hospitals. First up, Department of Health and Support.
We'll stand on our testimony and support you. Thank you.
Thank you. Director Yamane providing comments. Okay, Judy, please proceed.
Aloha, Chair. The Department of Human Services, we stand on our written testimony offering comments. Thank you.
Thank you very much. Lynn Fulton, Maui Health Systems and Support. Are you present?
I'm on Zoom.
Please proceed. Lynn
Yes,
Fulton.
we are standing on our testimony. I do want to express strong support for this bill because it will allow us to structure our hospital on Lanai to best meet the needs of that community while also bringing additional funding for health services on the island. Thank you.
Okay, thank you very much. Next, we have Paige Choi, Healthcare Association of Hawaii in support. Edward Chu, Hawaii Health Systems Corporation in support. Rosie Davis in support. Ellen Owai in support. Anybody else on SB 556? Seeing none, moving on. SB 851, relating to emergency response, Department of Health, in providing comments.
Yes.
Aloha, Christy Luke from EMS and Injury Prevention System Branch. We do have a revised version of the written comments that was submitted. The department offers a comment that this measure is premature and requires more community input and planning. While naloxone is an important medication to help prevent death from opioid overdose, currently EMTs and paramedics can administer this medication, while buprenorphine can help reduce opioid withdrawal symptoms and is most effective as part of a system of care with timely handoffs to treatment providers. Paramedics who practice under licensed physician's director would be more appropriate than EMTs to administer buprenorphine, but their protocols would have to be adjusted. So we suggest that communities and counties interested in this model should be required to submit a plan to DOH that identified resources along the entire continuum of care, as well as corresponding protocols and buprenorphine administration warm handoffs to treatment providers.
Thank you very much. Thank you. Next, we have Farah Aquino, County of Kauai Housing Agency in support. HSAC, Hawaii Substance Abuse Coalition, Alan Johnson in support. Big Island Substance Abuse Council in support. Dr. Hannah Preston Pita, are you present on Zoom? You have 1 minute, Dr. Hannah.
Yes, I am. Good afternoon. My name is Dr. Hannah Preston-Pizza, and I'm here in strong support of SB 851. I spent years working in substance use treatment and recovery, and in that time, I've seen too many lives lost, not because help wasn't available, but because there was a gap in care at the most critical moment. By equipping EMTs with the ability to administer buprenorphine and connect individuals directly to outpatient services, we can interrupt the cycle of overdose and relapse, and we can offer a real pathway to recovery, one that begins the moment someone is saved. I urge you to support SB 851 and help us close the gap between crisis and recovery. Mahalo for your time and consideration.
Okay, thank you very much. Next, we have Hawaii Island Community Health Center in support. Kapono Kakela, Hawaii Island Fentanyl Task Force in support. Kevin Kuntz, Dr. Kuntz in support. Are you present, Dr. Kuntz, on Zoom? Please proceed.
Aloha, Senator Joy and committee members. This bill will save hundreds of lives, and the sooner we get started on figuring out how to do it, the better. Final official data indicate we lost 335 people to an overdose in 2023. At least 1/3 of these were caused by fentanyl or another opioid. This percentage is increasing every year and will soon cause more deaths than methamphetamine. Hawaii can reasonably place buprenorphine into ambulances, train our EMS professionals, and have a robust clinical follow-up system in place. We should start planning that now. Money is not a barrier. Hawaii Opiate Settlement Fund has $35 million being held at DOH. Recruiting follow-up medical providers should not be an issue. ADAD, state, and federal funding already cover sufficient medical providers capable of this. This life-saving intervention has been successfully deployed in many states. The evidence base is clear that buprenorphine administered by EMS stops withdrawal and craving for these patients, and that continuation of it is life-saving and life-altering. This is a time to act. Hawaii has about 2,400 EMS-attended overdoses a year. Even if 1/3 of these folks went on to buprenorphine.
Thank you very much.
Thank you.
Okay, we have 7 other individuals in support. Anybody else wishing to testify on SB 851? Members, any questions? Next is SB 1042 relating to mental health. Attorney General providing comments. You can always rest, if you're just going to read.
Just very, very quickly, Alana Bryant, Deputy Attorney General. We've provided written comments regarding the requirements for special funds, and I'm available for any questions. Thank you.
Hawaii State Department of Health providing comments. Okay, you do have your comments too.
You do?
Yes.
Okay, we stand on our written testimony.
Thank you, Doctor. Okay, Luis Oliveira, Department of Budget and Finance providing comments. Office of the Governor, Dr. Champion providing comments. I saw him here. Thank you very much. Ashley Lukens, Clarity Project in support. Ashley, you got 1 minute.
I stand on my written testimony.
Thank you. Lieutenant General Martin Steele, Veteran Mental Health Leadership Coalition in support. Lieutenant General, you're present on Zoom. You have 1 minute.
Thank you, Madam Chair and members of the committee. I support this bill, and I have seen devastating impact of PTSD, traumatic brain injury, and treatment-resistant depression on those who have selflessly served our country. Every day, approximately 22 to 44 veterans are lost to suicide and substance-related deaths. FDA-designated breakthrough therapies, including MDMA and psilocybin-assisted treatments, have shown remarkable promise in clinical trials, providing rapid and long-lasting relief. SB 1042 establishes the Mental Health Emerging Therapy Special Fund to support research, professional training, and patient access to these life-saving therapies. I urge you to pass SB 1042. Thank you.
Thank you very much. Next, we have Jesse McCallan, Reason for Hope in support. Are you present, Jesse?
Yes, ma'am.
Okay,
Yes,
you have
ma'am.
1 minute.
Madam Chair, I stand on my testimony. I would just add that this is a good bill. It ought to pass. And a particular note, the bill will allow for philanthropic donations to come in order to support the purpose of the fund. Thank you, Madam Chair.
Okay, thank you very much. Next, we have Joseph De Lorenzo, Transcend Integration in support. Are you present, Joseph?
Not present on Zoom, Chair.
Lynette Averill, I see you here. Reason for Hope in support. Please proceed, Lynette. You have 1 minute.
Great, thank you. I strongly support SB 1042, and this issue is very personal. My father, a U.S. Marine, died by suicide after years of struggling with ineffective treatments. His life and subsequent death have shaped my career and certainly fuel my passion for this sort of work. As a clinician and researcher specializing in PTSD, depression, and suicidality, I have led multiple trials on novel therapies like MDMA and psilocybin, which have been designated by the FDA as breakthrough therapies for their ability to provide robust, rapid, fast-acting, safe, and lasting relief where other traditional treatments have fallen short. It is essential that you support advancing research, training professionals, and expanding patient access to these life-saving therapies. Other states have already taken action, and Hawaii now has the opportunity to lead. And what an opportunity it is. I urge you to pass this bill and invest in transformative treatments that will improve and save the lives of your constituents, and not just save lives to the point of tolerating existence like many of our currently available treatments do, but provide a foundation for people to build lives that they truly want.
Thank you very much. Next, we have, I'm sorry, excuse me, 22, a lot of people. Okay, Dore Shen, who registered in support.
And my testimony in strong support.
Okay, Josh Szz, how do you pronounce your last name? SZE?
Yeah,
Okay.
just like the letter C.
In support. Okay, you have 1 minute.
Hello, my name is Josh C. I'm a 10-year Navy veteran. I'm also disabled. I've been battling PTSD, depression, and anxiety for years. My struggles led me to homelessness, lost in a system that offered me medication but no real healing. Nothing worked. More days than not, I didn't care if I woke up the next day. And then I found out about psilocybin therapy, and that treatment changed everything for me. It helped me confront my trauma in a way that traditional therapies never could. It allowed me to break free from the cycle of despair and rebuild my life. Today, I am no longer homeless. I'm about to graduate with a bachelor's degree from UH Hilo in psychology this summer. It's something that I never thought possible. Plant medicine has the power to heal, and it should be accessible here in the United States. It is unacceptable that veterans like myself must travel outside the country for healing. This is more than just a bill, it's a lifeline. It's a chance for veterans and others suffering from severe mental health conditions to access a treatment that can truly heal. I urge our lawmakers to support this bill and give more people the opportunity to reclaim their lives.
Thank you
Mahalo.
very much. Next, we have Christina Baddock in support.
Thank you. My name is Christina Braddock. I'm a family nurse practitioner, a combat veteran, and a full-time caregiver. I spent 8 years as a trauma nurse in the United States Army, prepared for war overseas, but nothing prepared me for the battle at home. After returning home from Afghanistan while serving as a lead trauma nurse at Tripler, my husband sustained a severe traumatic brain injury here in Hawaii. He was pronounced brain dead at Queens. What followed was an unrelenting fight through a broken healthcare system that had no answers and no support. We traveled the country seeking care only to find dead ends. Brain injury isn't just physical. It brings more emotional damage, addiction, and post-traumatic stress. It tears families apart. The #1 reason mortality for these individuals is not with all the secondary and tertiary complications that come with it. It's death by suicide. Conventional medicine failed us, but when we left the US, we found treatments that saved both our lives. Psychedelic therapies, ibogaine, ayahuasca, psilocybin are demonstrating profound neuroregenerative and psychological benefits. The research is there, yet our system refuses to act. Every day, 50 veterans die by suicide, not including the overdoses and reckless behaviors from untreated trauma. These are our friends,
Thank you very
neighbors.
much.
Thank you.
Next, we have Vicky Farmer in support. Okay, you have 1 minute.
Hello, my name is Vicky Farmer. I'm a military spouse. My husband served 22 years in the Army within the Special Operations community. When he enlisted at 17, he didn't think he'd even make it to 40. Several years ago, we found ourselves in crisis. He had gone through 10 combat deployments, exposure to IEDs, mass casualties. His trauma led to severe PTS. We faced thoughts of losing him. We tried every therapy: music therapy, art therapy, talk therapy, equine therapy, neurofeedback, alpha stim, transcendental meditation, MERT, hyperbaric oxygen chamber, prolonged exposure, EMDR, every medication the VA offered, but nothing seemed to help. That's when I stumbled upon studies about psychedelics. I was hesitant at first, but after educating myself, we found hope through an organization called VETS in psychedelic medicine. It wasn't a magic fix, but it gave him relief, neuroplasticity, and space to process his trauma. Trauma affects the veteran and the whole family. Healing does too. It ripples throughout like a wave in the ocean. As a spouse, I've witnessed this. I'm hoping that you'll take this upon yourselves.
I'm sorry. We need to move on.
Okay.
There are a lot of people with similar stories, and I just want to apologize that we need to cut people off, but if we don't do it, and we won't be able to pass your bill.
I understand.
So, please,
Thank
thank
you.
you. Next is Erica Manzano in support. Erica, are you present? Randall Manzano in support. Randall, are you present? Edith Garcia in support. Are you present? Okay.
Aloha, my name is Edith Garcia and I am a Navy veteran. I traveled from Hilo to testify today for SB 1042. Like many other service members, I struggle with PTSD, anxiety, and depression. Instead of healing, my experiences within the VA system led to further trauma. And desperate for relief, I sought treatments overseas where I found hope. I am alive today because of those therapies. Despite anyone's opinions on psychedelics, SB 1042 is a vital step towards expanding evidence-based treatments, including psychedelic therapy, which has shown immense promise for mental health conditions affecting veterans. The science thus far is clear, and now it's time for Hawaii to lead in providing safe, regulated, and effective options. No veteran should have to leave their home to access life-saving care. I fought for this country, and now I ask you to fight for veterans' right to heal here in our homeland. Please pass SB 1042. Mahalo for your time.
Thank you very much. Next, we have Tai Cheng on Zoom. I see you, Tai. Please proceed. You have 1 minute.
Thank you, Chair. Good afternoon, Chair, Vice Chair, members of the committee. I'm Tai Cheng, founder of Aloha Green Apothecary, a licensed medical cannabis dispensary here on Oahu. We support SB 1042. Cannabis is already shown to help with symptoms of PTSD, and it's had to break free of the stigma that alternative therapies like MDMA currently face. The state has shown that you can regulate plant medicines with patient safety, public safety, and product safety in mind. I urge you to pass this bill. Thank you.
Thank you very much. Next, we have Robin Martin on Zoom. Robin, are you present on Zoom? No. Megan Smith on Zoom.
I'm present. Sorry. Hi, Chair,
Please
Vice Chair.
proceed.
Members of the committee, my name is Dr. Robin Martin. I'm with the Department of Psychiatry at Japson Medical School and private clinics in support of SB 1040. In my profession, I'm on the front lines of addressing the crisis, but you do not have to look far to appreciate the unmet need for new treatments. Depression is the leading cause of disability worldwide, and suicide is the leading cause of death for the youth of Hawaii. PTSD is estimated to impact 5% of the population, with women and veterans particularly impacted, and traditional treatments often do not work. There are important and promising new therapeutics being developed, such as MDMA and psilocybin-assisted psychotherapy, that have demonstrated 2/3 cure rate for PTSD and major depressive disorder, respectively. I've undergone specialized training in these treatments and believe they can be used safely and effectively in Hawaii. Happy to answer any questions the committee may have. Thank you.
Okay, thank you very much. Next, we have Megan Smith on Zoom. Are you present, Megan?
Not present on Zoom, Chair.
Christina Rodriguez on Zoom. Are you present, Christina? No.
Yes, I am present. Greetings, Chair, Vice Chair, and committee members. My name is Christina Rodriguez. I'm a registered nurse specializing in psychedelic-assisted therapy and behavioral health, living here on Maui, in strong support of this measure. I had the distinct honor of serving on the task force for last year's psilocybin bill, and I'm currently on the Board of Advisors for Clarity Project. I'm trained both in clinical Western medicine model and in traditional indigenous medicine cosmologies to work with psychedelic plant medicines. As such, I've had the opportunity to learn from and teach some of the brightest minds and hearts in the psychedelic medicine field. I'm also MAPS MDMA trained facilitator who's eager to see these medicines helping those who need it most. Ultimately, I'd like to remind you that while the medicines in questions for research funding are considered emerging and breakthrough therapies, science is only now substantiating what indigenous communities have known for millennia. Even MDMA has been used therapeutically since the early 1900s. Personally, my own experiences with these medicines have deepened my empathy and expanded my resilience and allowed me to process my past trauma and PTSD in ways that traditional therapy never could. Please support this bill for Hawaii. Thank you.
Thank you very much. Next, we have Jadu Jago. Are you present, Jadu?
Not present on Zoom, Chair.
Alexandra Takayesu on Zoom. Are you present, Alexandra? Okay.
Yes.
Please proceed. You have 1 minute.
Hi, thank you for having me today. I'm here to testify in support of this bill. I am a board certified psychiatrist who lives on Maui. I'm an assistant professor of psychiatry for Japson, and also sit on the State Maternal Mortality Review Committee. Unfortunately, the tools that we have as psychiatrists are not exactly cutting it, and we continue to have very high rates of suicide. Suicide remains one of the most horrific complications of postpartum depression here in Hawaii. I really urge you to pass this bill so we can increase funding for research. I am currently involved in a clinical trial here in Hawaii looking at a psilocybin-like drug. And I think it'd be really important for us to increase that access to our people. Thank you very much.
Okay, thank you very much. Okay, Rowan Ollier, are you present, Rowan?
Yes, present on Zoom.
Okay, you have 1 minute.
Thank you. I'm a registered nurse working alongside Dr. Robin Martin at Kahala Clinic and a few other private clinics.
We provide ketamine therapy for patients dealing with treatment-resistant depression, anxiety, PTSD, suicidality, and trauma. I've been a nurse and an officer in the U.S. Navy for over 10 years. I have experienced a large population of people struggling with their mental health, including veterans. In my practice, I witnessed firsthand the profound impact that psychedelic-assisted therapies can have on individuals who are often at the end of their rope after exhausting traditional treatments. Many of our patients have suffered from debilitating mental health conditions for years, and their struggles have often led to feelings of hopelessness and isolation. However, through this therapy with ketamine, we have observed patients experience real breakthroughs, opening doors to healing that previously thought impossible. We don't want the citizens of Hawaii to miss out on these healing modalities. With mental health becoming a more present issue in our communities, everyone knows someone who stands to benefit from access to psilocybin,
Thank you
MDMA,
very
and
much.
other breakthrough therapies.
Holly, thank you
Please
very
support
much.
this measure.
Thank you. We have 39 other individuals who have testified. Anybody else wishing to testify? You got 1 minute. Come on up.
Aloha, everyone. My name's Bobby Farmer. My wife testified just a few minutes ago. She's Vicky, 22 years, 10 rotations. I have almost 8 years on the ground in Afghanistan in direct combat operations, and I came home with PTSD. Like she stated, I went through every modality I possibly could to find care and find help, and was turned away. I had to leave this country to go get help. Real help. Like, I can come back to my family and I cannot scream with terror, night terrors. I can be a dad, I can be a husband again. And like Josh, I have gone into psychology and I'm now studying. I want to bring that back. I want to bring that back to the veterans and first responders. This bill, please pass it. Please pass it. It really does help. It really does work. And I'm not saying just willy-nilly it, put some barriers around it and make it safe for everybody. It's not for everybody, but for those who are seeking it, who have tried everything else, this is a lifesaver. And it was for me. Thank you so much for your time. I really appreciate you.
Okay, thank you very much. Anybody else wishing to testify in SB 1042? Come on up.
Hi, my name is Elizabeth Snyder. April 2020, after 2 consecutive life-threatening impacts, knocked me unconscious for more than 10 minutes. I can tell you my life didn't flash before my eyes, but my life did stop. I dropped over a quarter of my body weight, lost the ability to spell my name, couldn't recall memories each day from the day before, and I couldn't count. Before that, I was a competitive PhD applicant. I was applying to Yale. I was a statistics minor. After 4 years in treatment in Western medicine, nothing was working. I was told that there was no potential recovery. I sought functional neurology treatments combined with alternative medicine and psychedelics, and I immediately progressed and began working in the neurology clinic that I was recovering in. Today, I stand before you a student, a competitive graduate applicant, a researcher. Today, we develop integration, risk mitigation, and resources for families that can utilize these treatments, and we need the support through the research. Today, I and many people are alive due to these experimental medical treatments and their research. Today,
Sorry.
No problem. Thank you so much.
Okay, Angela Young, come on up. You got 1 minute. Okay. Okay. You heard. We're gonna have another hearing.
I heard.
Okay, you have 1 minute. Come on
Angela
up.
Melody Young testifying in support of the bill. Although I'm a Christian, I have friends who go to Coachella and Burning Man Festival who have mushroom businesses and prefer psychedelic assisted therapies. I don't know if I agree with all the practices. I think it's hard for us to find common ground, but I'm in favor of new therapies. I think this is a good compromise, so I can support the bill. If there is provisions for methods and strategies for new therapy research. I'm supportive of plant therapies and yoga to address underlying roots of stressful environments in our work culture because it impacts the quality of our community's health. And I'd also be in support of a virtual reality therapy, which uses computer-generated environments to help people confront and overcome fears and anxieties, to treat brain stimulation. And this kind of therapy also includes repetitive transcranial magnetic stimulation, and it can be used to treat depression, obsessive compulsive
Angela.
disorder, and other
You're
mental
done.
health disorders.
Sorry.
Thank you.
Okay, we're gonna recess, and we're gonna, the 1 o'clock calendar, we're gonna go into the joint HHS-HRE calendar, and after that's done, which is a one bill joint agenda, then we will come back to ask for more testimony on SB 1042. Okay, I don't need to gavel out, do I? No, okay. IT, do I need to gavel out for the joint hearing? We're gonna recess this 1 o'clock calendar, come back to it after the joint hearing.
Yes, Chair, gavel out.
Okay, we're gaveling out for a recess, and we will be back shortly. Calling the 1:30 hearing on the joint HHS-HRE hearing. We have one bill, and that is SB 1528. First up, for SB 1528, we have hold on. We have Department of Health in support.
Good afternoon. I'm Lola Irvin, representing Dr. Kenny Fink for the Department of Health. Thank you for the opportunity to testify. We do support this bill, and if we may, we would recommend that instead of just a 2-cent increase, it would be increased by 5 cents. So that would be Section 2, the new item 12 on page 7. Instead of 16 cents, it would 18 cents, it would be 21 cents. If it were a 5-cent increase, and then that would really have a public health impact. So from a public health perspective, we recommend that. Thank you.
Okay, thank you very much. Next, Department of Taxation providing comments.
Well, Chairs, Vice Chairs, Winston Wong on behalf of Department of Taxation. Department stands on its written testimony. We just want to reiterate that if there is a stamp increase, that we need time to implement that and order new stamps. So we ask that any stamp increase be effective on January 1st of the next year. Thank you.
2026.
Yes.
Thank you very much. Next, we have Deputy Attorney General in support.
Good afternoon, Chairs. My name is Rich Stacy. I'm head of the Tobacco Enforcement Unit. We do support. We recognize that the Cancer Center needs additional funding. As the chairs and the committees here are aware from last session, cigarette tax revenues are plummeting. This affects various entities. We prefer SB 1404 to the extent it's too late for that one. There is a House Bill 1085. This is one, basically at the end of last session, your committees worked on something that would have taxed vapes and would have helped other entities, for instance, our tobacco enforcement, since we have to enforce the MSA and avoid arbitration risk. So we prefer that. We do support the Cancer Center getting more money and available for questions.
Thank you very much. Next, we have Dr. Ueno, University of Hawaii System in support. I saw Dr. Ueno here. You have 1 minute.
Dear chairs and co-chairs, and thank you very much for the opportunity. I'm the director of University of Hawaii Cancer Center. I am going to testify from the perspective of physician scientists and cancer survivors. As you may know, that I had a fatal disease, and the only reason I'm existing here at this moment is because of early phase and clinical trials. That is the only reason. 40% of in this room will have some form of cancers, and eventually few of us will face a difficult time. And there's a significant loss of economically, probably in excess of $1 billion of medical costs going outside of Hawaii. And there are a lot more people who cannot even leave the island with their unique disease, particularly related to Native Hawaiian, Pacific Islander, and Filipinos. So I support this bill because we are here to make a difference for Hawaii and the Pacific. Thank you very much.
Okay, thank you very much. Next, we have Tom Yamachika, Tax Foundation of Hawaii, providing comments. Tom, are you present on Zoom?
Not present on Zoom, Chair.
Okay, next we have Kevin Ramirez, Hawaii Public Health Institute in support.
Aloha and good afternoon, chairs, vice chairs, and members of the committee. I'm Kevin Ramirez, a program manager for the Coalition for Tobacco-Free Hawaii, a program of the Hawaii Public Health Institute, here to testify in support with amendments for SB 1528. We respectfully request the bill be amended to raise the tax by at least $1 per pack to maximize potential public health benefits for youth prevention and adult cessation. More details are in our written testimony. Recent polling shows strong voter support. According to an independent poll conducted by Ward Research on our behalf, 78% of registered Hawaii voters support an increase in cigarette taxes, and 89% feel that it's important for the state to dedicate part of the tobacco tax revenue to support tobacco prevention and cessation programs. Thank you for the opportunity to provide testimony. Mahalo.
Okay, thank you very much. Next, we have Kevin Ramirez, Hawaii Public Health Institute in support. Kevin, that was you. Okay, Retail Merchants of Hawaii in opposition. Tina Yamaki, are you present on Zoom?
Not present on Zoom, Chair.
Okay, Cynthia Au, American Cancer Society Center Cancer Action Network.
Thank you. Chairs, vice chairs, and committee members. Cynthia Au on behalf of the American Cancer Society Cancer Action Network. 9,000 residents from Hawaii will hear the words, "You have cancer" this year, and more than 2,000 are going to die from the disease. While it's projected that there are more diagnoses in our state, there's going to be less deaths because of institutions like the Cancer Center who do research, education, and play a critical role here in Hawaii. ACS CAN supports increased funding for the UH Cancer Center. Cancer is the second leading cause of death in the state, and the #1 preventable cause of cancer is tobacco use. 1,400 people will die from smoking this year. Please consider increasing the cigarette tax to 5 cents per stick or $1, which will help to start the youth from starting to smoke and to help adults quit. Thank you.
Thank you very much. Next, we have HHS Hawaii Substance Abuse Coalition in support, Hawaii Pacific Health in support, Tax Foundation, Jack McCumber-Rosen providing comments, William Gu, Cigar Association of America in opposition, Jason Kulinet, Queens Health Systems in support, Hawaii COPD Coalition support, American Market in opposition, Campaign for Tobacco-Free Kids in support, Discount Smoke Shop in opposition, Hawaii Smokers Alliance in opposition, Bionic Petroleum in opposition, Wava Market in opposition, Chinatown Liquors in opposition, test #1 store, Ni Nam Huang. Are you present on Zoom? Ni Nam Huang.
Not present on Zoom, Chair.
Nobody else having registered to testify. We have 34 other individuals in support, 11 in opposition, Cigarettes and Things in opposition, Hawaii Medical Association, late support, R&K Liquor in opposition, and anybody else wishing to testify on SB 1528? Okay, got all right. Angela, come on, you got 1 minute.
Angela Melodion testifying in strong support of the Senate Bill 1528 for the Cancer Research Special Fund. So I think this can also help with so our generation's things that were invented, for example, the electronic nicotine device delivery systems, which affects cancer studies. So I think raising awareness about such a special fund and the cancer study is very important and necessary.
Okay, thank you very
to
much.
address underlying roots of cancer and health. Thank you.
Anybody else wishing to testify on SB 1528? Members, any questions? Can we go, you have a question? Okay, otherwise we're gonna go to decision making. We have quorum? HRE, okay, sounds good. So for SB number 1528, Chair's recommendation is to pass this with effective date of January 1, 2026 per tax, no tax, but also a defective date to continue the conversation. Any comments, questions, or concerns?
Effective date of what? July?
December 31, 2050. Sorry. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, pass with amendments.
Senate Bill 1528, recommendation of the chairs to pass with amendments. Chair and Vice Chair vote aye. Senator Hashimoto.
Aye.
Senator Keokolole.
Aye.
Senator Favela.
Aye.
Recommendation is adopted, Chair.
And for the Committee on Higher Education, same recommendation, passed with amendments. Vice Chair Kidani?
Committee on Higher
Chair
Education.
votes aye.
Committee on Higher Education to pass with amendments. Chair Kim.
Aye.
Vice Chair votes aye. Senator Fukunaga. Excuse. Senator Hashimoto.
Aye.
Senator Favela.
Aye.
Measures adopted, Madam Chair.
Thank you.
And with that, the joint session is adjourned. Recalling the 1 o'clock calendar for HHS, Health and Human Services. We are in the middle of receiving testimony from SB number 1042. No one else having registered for SB 1042. Anybody else wishing to testify on SB 1042? Members, any questions? Seeing none, moving on. For SB 1504, relating to cesspools. First up, we have Department of Hawaiian Homelands in support. Thank you very much. Next, we have Department of Health providing comments. Next, we have Lindsay Garcia, Realtors in support. Robin Knox, Hawaii Water Quality Consulting, Inc. in support. Hawaii Reef and Ocean Coalition in support. Douglas Perrin in support. Anybody else wishing to testify on SB 1504? Members, and well, there's no one to ask questions. Okay, we're gonna move on to decision making. We have quorum here. So first up, for SB, what's our first one? 298? 850. Okay. Where's my? I have my decision making. For 850, Chair's recommendation for 850 is to pass it with tech amendments for needed for clarity and consistency at a effective date of December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, Senate Bill 850, recommendation of the chairs to pass as a SD1. Chair and Vice Chair vote aye. Senator Hashimoto.
Aye.
Senator Keokolole.
Aye.
Senator Favela.
Aye.
Recommendation is adopted, Chair.
So for SB 836, Chair's recommendation is to pass this with amendments per Department of Health. We are gonna add a blank appropriation amount to allow them to hire a facilitator for the working group and add a defective date. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, pass with amendments.
Senator 838.
Yes.
Okay.
836, excuse me. Oh, I'm sorry, it's SB 838, excuse me, my notes are wrong. So for SB 838, relating to water catchment systems, Chair's recommendation on that one was to pass with amendments. And
The health insurance, Senator.
836 is catchment, 838 is health insurance.
okay. We're back to SB 836, where I announced my decision, and I will go back to 838 after this. Okay, so for 836, relating to water catchment systems, Chair's recommendation on that is to pass with amendments for Department of Health, add a blank appropriation amount for Department of Health to hire a facilitator for the working group and a defective date. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 836, recommendation of the chairs to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 838 relating to health insurance, Chair's recommendation is to pass this with Attorney General's and DHS's proposed amendments and tech amendments needed for clarity and consistency. I'm going to note that since both Medicaid and various health insurance are already providing continuous glucose monitoring. The legislature does not believe a sunrise analysis is necessary. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, thank you, Chair. Senate Bill 838, recommendation of the chairs to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, thank you very much. Next is SB 829 relating to healthcare. We're going to defer that because HB 799, the House Companion, is moving. Okay, next one, SB 446. Chair's recommendation is to pass that with amendments, with Department of Health's proposed amendments, and Earth Justice's proposed amendment to add paragraph D on page 5, line 15, under section 342H-52. Tech amendments as necessary and a defective date, because late testimony keeps appearing on that one. So any comments, questions, and any tech amendments needed for clarity and consistency? Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Yes, Senate Bill 446, recommendation of the chairs to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 339, we're going to defer that because HB 1477 is continuing. However, if DHS is here, we are going to request that they give us appropriation amount for HB 1477 to make the caregivers whole due to the error that occurred in the last legislative session. So for SB 556, relating to rural emergency hospitals, we're also going to defer that because the House Companion is moving. And for SB 851, relating to emergency response, also going to defer that because House Companion is moving. SB 1042, emerging therapies. We're going to pass this with a defective date. We're going to allow the advocates to respond to the AG's concerns because it's just going to let you know that this is not going to pass conference unless you folks come up with a self-sustaining fund. Donations alone is not going to be able to cut the Attorney General's concerns. So, but we're going to allow you folks to keep trying. That's why the defective date, okay? So blank appropriation is on there. Again, this bill is not going to pass when there are blanks in the bill. So any comments, questions, concerns? Pass with amendments.
Okay, Senate Bill 1042, recommendation of the chairs to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SB 1504, Chair's recommendation is to pass with amendments. We're going to insert the year 2038 for the new sunset date and remove the appropriation language per DOH as SB 675 is moving. So there's no need for appropriation. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, Senate Bill 1504, recommendation of the chairs to pass with amendments. All members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, so we are now going to move on to the 1:30 deferred decision-making agenda with AEN. And I believe AEN has finally come up with a decision. So for SB 1528, no, excuse me, we did that one. 1633, relating to hemp. Chair's recommendation is to follow AEN's chair's recommendation, and that is to pass it with amendments. We are going to amend section 2, 328G-A to state, notwithstanding 328G-3 sub E, any hemp processor with a permit pursuant to section 328G-2 may sell, hold, offer, or distribute for sale an edible or beverage cannabinoid product that contains a tetrahydrocannabinol concentration of not more than 2.5 milligrams per serving and not more than 30 servings per package, as is standard with the industry. We are also going to add an effective date of July 1, 2050. Any comments, questions, concerns? Seeing none, Vice Chair, pass with amendments for the vote on SD 1633.
Okay, a recommendation of the chair is to pass as a SD1. All members are present. Any reservations? Any noes? Reservations for Senator Favela. Any other reservations? No votes. Recommendation is adopted, Chair.
Okay, thank you very much. And it appears that we are done with all the calendars for HHS for today. Thank you very much, and we are adjourned.